Assalamu alaikum. My name is Dr. Muhammad Musbah Shaheen, and today's topic of lecture is preventive dental materials. Types of dental materials are preventive, restorative, and auxiliary. In the end of lecture, student should be able to explain the terminologies regarding preventive materials. Student should have knowledge about the type of preventive materials. Students should be able to describe the ideal requirements of preventive materials. Students should know the composition, properties, as well as applications of all preventive materials used in dentistry, and student should learn the application techniques of different preventive materials, how to use those materials in daily life dental procedures. The topic of preventive dental materials has been divided into two lectures, and in today's lecture we will cover following points, which are different types of preventive materials, toothbrushes and their types, dentifrices, their composition and types, dental floss and its uses, interdental cleansing brushes, and mouthwash along with its composition, types and uses. Preventive dental materials can be divided into different categories according to their use. Tooth cleaning materials for routine oral hygiene procedures are toothbrushes, dentifrices, which could be toothpaste or tooth powders, dental floss, interdental cleansing aids. In picture, you can see toothbrush, tooth powder, and on left bottom picture you can see interdental cleansing aid, which is also called interdental micro brush, and picture on right bottom you can see dental floss. Non-invasive preventive materials include mouthwashes and fluorides. Invasive preventive materials include pit and fissure sealants. If we talk about toothbrushes, toothbrush have bristles which are made of natural or nylon. Bristles are better than natural bristles as they remain straight and stiff for longer time and dry out quickly. In picture you can see different types of brushes. some brush some brushes have smaller head size, and other brushes have larger head size. Brushes with smaller head size are easy to use. Toothbrushes can also be categorized according to the hardness of their bristles. According to the hardness of bristles, toothbrushes are categorized into hard, medium, and soft. Soft brushes should be used as they prevent abrasive wear of tooth structure. Special brushes are also available in market, which are used for cleansing of denture for orthodontic patients. In orthodontic patients, it is very difficult to clean the teeth. So there are some special brushes available which can be used to clean teeth with braces, and there are some electronic toothbrushes also available in market which are used to clean teeth in mental retarded patients. In picture you can see electronic toothbrush. Next is dentifrice. A dentifrice is a substance used with a toothbrush for the purpose of cleaning the accessible surface of teeth. Application of dentifrices. Amount of toothpaste or gel needed for effective cleaning is precise. Dab on the top half of the toothbrush. Dentifrice should preferably dispersed in between bristles rather than on the tips. Children under 6 years of age should only be given half the amount of dentifrice as compared to that of adult. There are different forms of dentifrices which are toothpaste, tooth powders, and tooth gels. Toothpaste. What is toothpaste? Toothpaste is a substance used with a toothbrush for the purpose of cleaning the accessible surfaces of teeth. The purpose to use toothpaste are to clean the teeth, polishing, or removal of stains from the surface of teeth, reduce incidence of tooth decay, and reduction of oral odor. If we look upon the composition of toothpaste contain abrasives up to 20 to 40%. Abrasives are solid and insoluble particles which causes abrasion, remove debris and residual strain from teeth. Abrasives are present in the form of aluminum oxide, calcium pyrophosphate, carbonates like sodium bicarbonate, calcium carbonate, and silica. Binders are also present in toothpaste up to 2%. Binders are used to provide consistency and shape. Binders are present in the form of polymers like carboxymethyl cellulose, alginate, gums. Humectants are present up to 20 to 40%. These are used in toothpaste to prevent loss of water and subsequent hardening of the product upon exposure to air. Humectants are present in the form of glycerin, sorbitol, polyethylene glycol, mannitol, propylene glycol. Sweeteners and flavors are also present in toothpaste up to 2%. These are used to improve taste of toothpaste. Sweetener present in the toothpaste can be sodium saccharin, sorbitol, mannitol, or xylitol. Flavors present in toothpaste are peppermint or spearmint. Surfactants are also present in toothpaste up to 1 to 2%. These are used to produce foam and aid in the removal of debris. Surfactants are present in the form of sodium lauryl sulfate, sodium N-lauryl polyethylene glycol. Fluorides are also present in toothpaste. The concentration of fluoride for adults is 100 ppm to 1450 ppm, and concentration of fluoride for children is less than 1000 ppm. Fluoride increases resistance to enamel solubility. Fluoride is present in the form of sodium fluoride, sodium monofluorophosphate, and stannous fluoride. And finally, preservatives are also added into toothpaste up to 1% or less than 1%. These are used to prevent the growth of microorganisms. Preservatives present in the toothpaste can be alcohol, sodium benzoate. There are different types of toothpaste available in the market, which can be anti-caries or cavity protection toothpaste. These pastes contain sodium fluoride and sodium monofluorophosphate. These pastes contain fluoride to stop tooth enamel decalcification and protect teeth from tooth decay and cavities. Example of anti-caries toothpaste is Colgate Cavity Protection Toothpaste. Plaque and gingivitis prevention toothpaste are also available. In this paste, sodium lauryl sulfate, triclosan, zinc, and stannous ions are present. These paste are antibacterial and prevent the formation of dental plaque. Example of plaque and gingivitis preventive toothpaste is Crest Pro Health Clinical Gum Protection Toothpaste. Next type of toothpaste is tooth whitening toothpaste. These paste contain papain and dimethicone. Tooth whitening toothpastes have either high abrasion value than normal toothpaste to mechanically remove food, smoking, and other stains from teeth. Example of tooth whitening toothpaste is Colgate Optical White and Colgate Pro Clinical White toothpaste. Next is sensitivity toothpaste. This paste contains potassium nitrate, strontium chloride, potassium citrate. Sensitivity toothpaste contain desensitizing agents to relieve those with tooth sensitivity by closing the dentinal tubules. Example of sensitivity toothpastes are Colgate sensitivity toothpaste and Sensodyne toothpaste. Next is tartar control toothpastes. These pastes have pyrophosphates. These paste is used to reduce new tartar buildup, but they can't remove the existing tartar. Example of these toothpaste is Colgate tartar protection with whitening toothpaste. Next paste available in the market is fresh breathing toothpaste. These paste contain peppermint, spearmint, or menthol. These pastes are used to enhance flavoring agents along with antibacterials to fight halitosis. Example is Colgate Max Fresh toothpaste. Next is tooth powders. Tooth powder is a mildly abrasive powder that is used in combination with a toothbrush to maintain oral hygiene. The manufacture of tooth powder is the manufacturing of tooth powder is comparatively simple operation. The primary objective is the homogeneous distribution of all the ingredients without contamination by a foreign substance. Tooth powder can be prepared by granulating the powders by drying slurries containing the extremely finely divided polishing agents, a detergent, and a small amount of binder. The dried product is then sorry, comminuted and mixed with flavoring products. The size of granules of tooth powders should be such that substantially all are retained on a 100 mesh but pass through a 40 mesh screen. Making of tooth powder is simple and inexpensive and requires ingredients you properly you probably already have in your home. Components of tooth powders are abrasives like phosphate salts, precipitated chalk, silica, etc. for the purpose of cleaning and polishing. Detergents is also added to tooth powder, which is used for foaming purpose. Types of tooth powders are whitening tooth powder, natural tooth powder, herbal tooth powder, and homemade tooth powder. Uses of tooth powders. Tooth powders are used to promote oral hygiene. Tooth powders serve as an abrasive that aids in removing the dental plaque and food from the teeth. Assist in suppressing halitosis. It also help to Tooth powders also help to prevent tooth and gum disease like gingivitis. Well, next preventive material is dental floss. Dental floss is a thread of synthetic fibers and is supplied as either waxed or unwaxed. The unwaxed floss may be more effective at collecting plaque, but it tends to break easily. Waxed floss is more popular among the patients. In picture you can see dental floss. Next is interdental cleansing aid. Interdental cleansing brush or are used to remove plaque from interdental areas like furcation area, grade 2 or 3 furcation area, which is difficult to assess by using normal toothbrush. In picture you can see micro brush which are used to clean the furcation area and braces. Well, next is non-abrasive preventive materials, which include which includes mouthwashes and fluorides. In picture you can see mouthwashes and fluoride varnish and fluoride gels. What is mouthwash? A mouthwash is defined as a non-sterile aqueous solution used mostly for its deodorant, refreshing, or antiseptic effect. Mouthwashes are designed to reduce oral bacteria, remove food particles, temporarily reduce bad breath, and provide a pleasant taste. Mouth washes are generally classified as either cosmetic or therapeutic or a combination of both. The uses of mouthwashes are to help remove oral debris from before or after brushing, temporarily suppress bad breath, diminish bacteria in the mouth, and to refresh the mouth with the pleasant taste. If we look upon the composition of the mouthwashes, mouthwashes is composed of chlorhexidine alcohol, glycerin, sodium saccharin, polyethylene glycol, 40 sorbitol, diisostearate, flavoring agent, purified water. In mouthwashes, active agent are anticaries or antimicrobial. Solution is made of water, alcohol, and preservatives, or solution contain water, alcohol, and preservative. Surfactant is sodium lauryl sulfate. pH of sodium lauryl sulfate or surfactant should be 3.4 to 6.6, and ethanol 0 to 27%. Side effects of long-term use of mouthwashes are carcinogenic effects, staining, tongue papilla, discumation. Types of mouthwashes. Based on ingredients, mouthwashes are classified as fluoride mouthwashes. It contains fluoride, a chemical that help in fighting against tooth decay. Example of fluoride mouthwashes available in market are Listerine Total Care, Listerine Fluoride Defense mouthwash, or Colgate Ortho Defense mouthwash. Next is antiseptic mouthwashes. It contains chlorhexidine gluconate, which obstruct the growth of bacteria, suitable for infections, bad breath before and after surgery, to fight against oral bacteria and infections. Example of Antiseptic mouthwash washes available in market are Listerine Coolment Antiseptic Mouthwash, Enziclor Mouthwash, Clinica Mouthwash. Next is natural mouthwashes. They are homemade mouthwashes. They contain only salt and warm water. This is all from today's lecture. The remaining preventive materials, which are fluoride and Pitt and Fisher sealants, will be covered in next lecture. Thank you so much.